Omaha's news leader, chronicling the stories and people making a difference in our community. This is KETV News Watch 7's Chronicle.
Good morning and welcome to KETV Chronicle. I'm Waverly Monroe. Now, we've been living with COVID-19 for more than 2 years, and while we appear to be on the backside of the latest surge, the pandemic continues to take a toll on people nationwide, especially people of color. So what does that look like here in Nebraska? This morning, we'll hear from a doctor with Nebraska Medicine on those health disparities. One of the issues we've seen is equitable access to testing in the metro. With inconsistent mass testing sites and hard to come by appointments, many look to the county to fix these problems. I spoke with leaders last month who said there's really no solution.
The growing concern for testing accessibility came out in Wednesday's Board of Health meeting, especially regarding North and South Omaha. But board member Kiana King says the shortage is everywhere.
The fact is that there aren't many testing sites in general in the city, so I wouldn't just attribute that to one area of the city.
And the assistant professor at UNMC's College of Public Health says the county has a myriad of issues to try and solve. And until that happens, testing sites like One World have had to seek assistance elsewhere.
I would call it more just-in-time kinds of ordering.
CEO Andrea Skulkin's getting supplies from the feds like KN95 masks as well as rapid and PCR tests. And with 500 employees, she says those resources will be for patients and staff because there's simply not enough to give out.
So they go quickly.
Similarly, with Charles Drew Health Center across the city in North Omaha.
So what we ultimately ended up doing is taking care of our employees, so making sure all of Charles Drew employees that wanted at least 2 kits.
CEO there, Kenny McMorris, says they'll distribute some test kits through their community partners, but both say those resources are not consistent.
The site, they asked all the health centers to put a hold on ordering as of recently, just because demand has been extremely high. So I'm not sure if we're going to receive the order that we put in last week, this week.
King says the county as a whole is understaffed and resources are limited.
I don't think that the county is intentionally taking their time or dragging their feet.
Okay, well, joining me now is Douglas County Commissioner and Board of Health President Chris Rogers. Thank you so much for joining us this morning.
Good morning.
Yes. So when the Omicron surge started ramping up, we saw demand for COVID-19 testing jump through the roof. There were conversations about expanding testings, and can you give us an update on where those talks are now?
Well, I mean, right now, I think we're adjusting to where the virus is. I mean, the situation was never about the test. I think the situation was we thought we knew the virus. We had testing available ever since the pandemic started to some degree. Testing was available over the summer, but all of a sudden the virus went into a new stage. I think what we need to get used to now is the fact that we don't know the virus, and we need to get an idea of how we're going to respond now once we go through these surges. I mean, everything that happened was nothing that wasn't predicted. We were encouraging, and we still are encouraging people to get vaccinations. And really, until you get a certain level of people vaccinated, you're going to have these morphines and things that can happen. So right now, we just need to get used to, and the community needs to get used to the fact that this virus is going to be here. We're going to have to get used to these ebbs and flows, and the fact that we probably only know 40% of this virus right now.
So I understand that we can't predict the pandemic. It's very new to us. But are there conversations that are turning into still opening testing sites? Because there seems to still be a need for it.
Well, it basically gets to a supply and demand issue. The question really comes to we had testing sites up until vaccination started happening. Then it switched into vaccination mode. The question is, how do you keep that apparatus up constantly? I think it was mentioned in the intro, the fact of just in time. So I think it goes back to the fact of we've got to, from the federal level to the state level to the local level, comprehensively find a way to adjust to the ebbs and flows. Right now, things are going down, and you don't have this crazy demand of test lines like you did. Now you have at-home testing that's available to people. So we've got a new method and access of testing that takes some of that relief off. I think the question that we've really got to do now is to try to get some air that this thing is down and try to be imaginative and have imaginative and have all the possibilities thought through of where this can go. And like I said, we don't know where that's going to go, but we have to be fluid in trying to learn and adjust as this thing goes. It's not going to be the end of it. We don't have the vaccination levels yet. You need to be probably in the 80s or so to really have a good, hard immunity to some degree. People think that getting the virus gives you a degree of immunity. That's different with everybody. It's just for a certain amount of time. So what, in 3 months, we're going to go through this period again? I think we need everybody to get vaccinated so we can try to harden ourselves, get things normal as much as we can. But until we get vaccination levels there, this is something we're going to have to adjust to along the way and just be ready to see what the next stage is and how do we meet that need.
I wanted to kind of talk about recognizing the years-long and embedded racism that comes with any entity, right? We see it a lot of times with health systems. Kenny McMorris with Charles Drew talks about it a lot. But also, has the county really taken that step, and maybe that's something that we're not, aware of, that the county has been doing to address some of the embedded racism that does impact people of color, Black and brown people, that has really been overly exposed because of the pandemic?
I think one, the health department has been talking about dealing with trying to address health disparities for the time period that I've been on the board. It's ramped up over the years. But note, addressing the disparities that are in the system is not totally the health department can't do that by itself. 20% of your health care is determined by insurance, your access to care. The other 80% is determined by where you live, your work environment, other things of that sort. So I think what the pandemic did is it exposed the fact that public health is in everyone's lives in a myriad of ways that you don't see and you've never experienced. So when we talk about trying to address those inequities, it's the health department's role, and we've been bringing that up. And we put that on, I think, tried to really put that into the limelight in 2020 when we declared racism as a public health crisis. The thing that we're planning and trying to do now is to really elevate and frame those structures and where things are in the system so they can change. Housing is a big element, so you have a piece there. Education is a big element. For years, there's been stress tied to jobs and things of that sort for where you are. So it's not totally the health department's role, but the health department definitely has a role in bringing that to the attention and trying to convene people together to address that.
I agree, and I appreciate you sitting down with us. It was a really important conversation, and obviously there's still a long ways to go, but it sounds like we're on the right track, so I appreciate it.
We're on the right track. We've got a ways to go. I mean, since the pandemic, we started laying a lot of this groundwork probably 3 years ago in some studies that we've been trying to tee up. I mean, when things happened in June of 2020, it opened the window to be able to get there, but we have been planning to go this route as racism as a public health crisis for about 3 years. The window opened with the George Floyd death, but note, since that's happened, we've stood up some standing committees for North and South Omaha where we're creating this information flow to get feedback and try to work with the community in a stronger method. We've hired a diversity and equity supervisor to really get at some of the structural elements that have been created towards COVID and how do we address them in the long term. And we've hired a separate epidemiologist that's to help us to track some of the histories of where this at and start laying out the framework and the structures that have got us here from to the inequalities.
Okay, thank you so much. Well, still to come, the CDC says that more work needs to be done to address inequities in COVID-19 treatments. What the agency says could be leading to those gaps and what doctors are seeing in the metro. You're watching KETV News Watch 7 Chronicle.